Hello, you might be on one of these pages because you have a disc injury or a stenosis injury either in your lower back or your neck, and you're looking to try and get some help. So many of you have got questions at this point, and what I want to do is just answer some of your more frequently asked questions. So one of the questions we get asked a lot is, how does IDD work? Well, first of all, IDD works to help to get your spine moving properly again. So over time, spines become compressed and the discs and the joints and the nerves and the muscles aren't moving properly. And the idea of IDD therapy is to help to decompress that area, to create space back in the area so that the joints can move properly, the discs become well hydrated, and the nerves and the muscles are all working as efficiently as they should be. So it helps to reverse that process that's happened in the first place. And over a course of sessions, we can certainly expect to get the spine moving properly again. Another question we get asked is, will this help in the long term? Will this help to get my back or neck back to the place where it used to be and stop frequent reoccurrences? And certainly, yes is the answer. The lower back and the neck, because we're addressing the long-term issues of getting the spine moving properly again, then we can certainly, after a course of sessions, expect that the spine won't get into trouble again. Some of our more longer-term patients that have had a very, sort of 10, 15, 20-year history of back issues may come along and have some top-up issues, top-up treatments to start with, but certainly we're aiming to address the spine in the long term. We're not just simply suppressing symptoms like medication may do. So, what's the cost of IDD? Well, it does depend and vary much on your particular condition that you suffer from. So, once we understand the diagnosis, and we'll do that essentially through the initial assessment, we'll be looking at how severe the condition is, we'll be looking at how long you've had it, and also be checking your suitability. So that initial assessment is very important to be able to understand your problem thoroughly and answer all those questions. So once we understand your issue, then we can certainly discuss how many sessions it will require. But first of all, the initial assessment, which is a very thorough 1-hour assessment where we'll examine you, have a look at your history, and discuss the plan going forward, then that's an £80 charge. And if IDD was appropriate, that would be £75 per session. And the number of sessions, as I say, would be outlined once we understand your problem thoroughly. So what's the success rate of IDD? Well, I would certainly define success as being out of pain, out of symptoms, but also enabling you to live the life that you want to live, enabling you to get back to those activities that you want to do. And from that, we have an over 80% success rate. And certainly we would make sure that you were appropriate for treatment and suitable for treatment, that we would very likely have a positive success rate for you. And then what other treatments have, if other treatments in the past haven't helped, how can IDD help? Well, many of our patients will have already had quite a number of treatments or tried things beforehand, in particular the manual treatments like osteopathy, physiotherapy, chiropractic or acupuncture, and maybe have had limited success. And sometimes disc and stenosis conditions will require additional treatment. So certainly IDD helps to address that difference in terms of we don't want to do the same thing that hasn't helped you in the first place. We want to give you something else. And IDD was designed for disc and stenosis patients. And some of you that also have had injections in the past that haven't helped. And this can be quite typical. Injections tends to be variable in its success rate. So we will take on patients that haven't had success with that or even just want to avoid it or surgery. So I hope that helps to address some of the questions that you may have, and you may well have many more, and that's absolutely fine. we're more than happy to talk through your individual case. So if you fill in the form below, give us some idea of what you've been suffering from, one of our team will give you a call back and then book you in for an assessment if appropriate. Okay, hope that helps. Thank you.